Good morning and welcome to Memphis Today. I'm Mandy Morgan, and my guest this morning is Dr. Warren Johnson and Melissa Moore. She's the CPO of the Eyewear Gallery. Good morning.
Good morning.
Good morning, Mandy.
Thank you for joining me here, and we are going to get into why it's important to protect your eyes, especially from UAV and UAB rays. But I wanted to share something with you. When they came into my studio, we sat down just a few minutes ago behind the scenes, and I found out what they do in their office. I was kind of blown away because if you don't regularly go and have your eyes checked, you may not realize what you're missing out on. Or if you go to a doc in the box kind of place, they don't give you the same kind of service. So I'm going to start with you, Dr. Johnson. If you'll just tell me what makes you different than, say, those big national chains.
Oh, I'm different.
Oh, you're very different. And it's all very good. I mean, it blew my mind.
Yeah, not necessarily an eye care. But anyway, Mandy.
Weirdo.
Weirdo. I think that we've worked really hard for a number of years. There's myself and another doctor in the practice, and we have a great team of people in the office that we collectively decide, what are we about? What are we there for? We're not there for just helping people pick out frames that make them look good. We're there to help them understand their vision system so they don't lose their vision, so they don't outlive their vision. I think from the surveys that we get back, that we find out that most people will say the information that you've given me in regards to my eye health, that I didn't know that that had anything to do with how my glasses were working. Because we always like to laugh about, when was your last eye exam? And they say, well, I guess I've had these glasses for 10 years. And we'll say, well, have you brushed your teeth since then? And they laugh because we know and they know, well, no, I didn't wait till my teeth started hurting before I decided to pick up the toothbrush. So we make that analogy and then they get it. When we show them the images of the back of their eye,
which are digital images.
Mm-hmm.
So this isn't the kind of eye vision, examination where you get in and the doctor's right in your face and they're, doing little things with knobs. This is entirely different.
Yes, we still use some knobs.
Well, I know they're knobs, but it's digital.
Right. So we check blood pressure. We had this conversation prior to this recording, and we find that given the health conditions, especially in this city,
right,
that so many people are hypertensive, so many people are diabetic, that all those things can cause things like glaucoma, which is sight-threatening, for which there are 2 million people in this country here losing their vision to that alone because they can't detect it by the way they see in their glasses. Macular disease. We are going to have the greatest number in our population, especially boomers, are going to live much longer. And that's going to be one of the leading causes of blindness. So many people will not outlive their vision.
And that is something that I really liked about you guys. I really appreciated it when you came in and we talked about it. It seems like you do genuinely care more about the person's health and the care of their vision than selling a pair of glasses.
Yes. Yeah, and we take more time with the patient, so we aren't seeing people every 5 to 10 minutes.
It takes how long for an average appointment?
I guess in preliminary testing and seeing the doctor, you're probably at least seeing us 40 minutes.
Now think about that. If you've had your vision checked recently, how long did the doctor spend with you? And now look at 40 minutes is how long you spend with them. And, not only that, but you care about their conditions to the point where if you are diabetic, I'm going to ask you to come back and maybe more than once a year. And that's important. So I just have the greatest respect. Again, this is the Eyewear Gallery. They're on Poplar and Perkins. And now we'll go ahead and talk about what we had originally planned to talk about, which was sun damage to the eyes. I had no idea that melanoma is something that you could get on your eyes. And we're going to get to that. But first, let's just start out with something simple and why it's important for people to protect their eyes and their skin from sun damage in general.
Okay. Well, basically, UV rays definitely are one of the biggest culprits, if you will, of cataracts, as well as macular degeneration. And people don't seem to realize that most of that damage is done between 0 and 18 years of age, where you think about cataracts as something that older people get, but basically at that point you're past the point of prevention.
The damage was already done.
Exactly. So one of the main ways to prevent that damage is by using, brow bone to cheekbone wrap protection sunglasses that are UV protective, which is more than what the sticker says on the sunglasses.
I was going to talk to you about that. What is UVA, UVB? I don't understand the differences between those.
So kind of a good way, a layman's way, kind of that I remember it is UVA stands for aging, UVB stands for burning, and UVC would stand for cancer. So just kind of a way to remember it is that UVB rays and UVC rays are going to be your more damaging sun rays, whereas the UVA rays are a little bit easier to protect from. But anything that you put over your eyes as well as your sunscreen, you want to have UV protective lenses as well as zinc in your sunscreen to protect against those rays.
And I'm telling you, it doesn't just help your skin when it comes to aging, the sunscreen, but it does help you with your health. You don't want to end up with skin cancer. It's vicious. And something as simple as sunscreen can help you with that. And I didn't realize it was as important for your eyes. I have sunglasses. I don't even know if they protect from UVA or UVB rays.
Yeah, and you can bring those sunglasses in and we can check them. We've got a meter that can actually determine whether or not your lenses are 100% UV protective or not. And that takes about 2 minutes. So, bring them on in and we'll be happy to check them for that.
And if they're not, I'm sure you have a nice selection of sunglasses that we could choose from.
Absolutely.
See, it works out for us in both ways. Now, what are some things people can do to protect their eyes and skin other than just sunglasses and sunscreen? Or is that basically it? Is it really, truly that simple?
Well, I mean, staying out of the sun, obviously, but that's not going to happen. Anytime you're going to be outdoors for more than 10, 15 minutes, you want to have some good protective sunglasses, even a cap to help shield your eyes. But, your sunglasses are definitely going to be your number one line of defense.
And if you have younger children, especially, you're saying that most of this damage is done when you're younger. Exactly. So it really isn't an unreasonable request for you to make your 5-year-old wear their sunglasses.
Absolutely. And it's kind of like, their church shoes or something. You want to put them up and make sure that they're well taken care of, but because it is an investment, but you definitely want to have your young children with sunglasses on when they're going to be outdoors. You put sunscreen all over their bodies. You want to put that sunscreen on their eyes as well.
And we don't think about that.
Exactly.
And so that's a really good point. So when it comes to UVA and UVB rays, which one is worse? UVB?
So the UVB ray is going to be more damaging. They're all bad. They're all going to cause.
I've never even heard of UVC.
Exactly. So the UVB rays are definitely going to be more damaging. They're going to cause skin cancer and sunburns more often than the UVA rays.
So when you see a pair of sunglasses anywhere and they've got a sticker that says protects from UVA and UVB, does that really mean that those sunglasses do? Is there any guarantee that that's the truth?
Not necessarily. Some manufacturers are good at just slapping stickers on things to make people feel like they're doing the right thing for their families. It doesn't necessarily mean that they're giving you the maximum amount of 100% UVA protection, UVA, B, and C protection.
So it might give you a little bit, but not what you need.
Exactly.
See, that's an important distinction to make because there is no law requiring them to say how much.
That's exactly correct.
What's interesting, I think, about that is that any lens, whether it's clear or whether it's tinted, has UV protection in it to a certain percentage. So they can say UV protection.
For any lens.
For any lens. So if you go and pick up off the rack sun lenses that you think with the sticker you're doing yourself well, that actually if they aren't 100% covering these UVA, UVB types of ultraviolet light that is damaging, actually you're doing more damage to your eyes because it's like going in a dark room or a cave and your pupil dilates, so you're actually more exposed to damage wearing those lenses than you are if you just went outside and didn't wear any.
I didn't even think about that, but that makes perfect sense because your pupil does dilate.
Your pupil constricts under bright light, more protective, and it dilates in a dark environment.
When it's shaded.
Yes.
So even if those lenses don't do anything, your pupil's going to dilate and they could actually be doing more damage.
Yes.
That's a very valid point. When it comes to sun damage to the eyes, What are some symptoms to where you know, oh boy, I've got sun damage on my eyes? What are some of the symptoms we're going to look for?
Well, Melissa said several things. I think that a lot of times people they really can't determine whether or not. Now, one of the things is their vision might be blurry, but they could decide that that's because they need new glasses, and it could be because of cataracts, or it could be early macular disease, or some type of damage in the back of the eye called the retina. It could be that there's a lesion around your lid or skin around your cheekbones that is bleeding or is dark or has blood vessels growing into it or is excavated. Because we find lesions in the eye, in the back of the eye, in the colored portion of your eye, as well as on your skin and lid tissues.
And you would see the ones on your skin or your lid tissues, but not the ones on the back of your eye.
Right. And you should, if you do start to see a small mole or freckle and you think, that wasn't there before, and that's getting a little bit bigger and this is looking odd, you ought to see like a skin doctor, or you can come to us if it's around your eye so we can see if there's other things in the eye related to that, for which we would then send you to an appropriate surgeon or another specialist.
To have it removed.
Right.
And probably biopsied.
Right, definitely first, yeah.
Figure out what's going on there. So when it comes to melanoma, which is a type of skin cancer, how common is it? Is it a common cancer, or is it kind of rare?
It's actually the most common form of skin cancer, for young adults, as well as for adolescents between 15 and 29 years of age. So it is a rarer kind of skin cancer, but it is actually the most deadly as well.
Yeah, it's very dangerous.
Exactly.
Now, I think I read somewhere, and I'm sure that you can set me straight on this, that it only takes 3 to 5 major sunburns in your life to increase your risk of melanoma by like 85%. It doesn't take much when it comes to damage to your skin, or I imagine your eyes,
exactly,
before you're at risk.
And it's cumulative. I mean, you figure, all the time you were a little kid out in the sun without sunscreen on, those couple of times where you got burned at the beach. And I mean, it's all cumulative over your lifetime. So you got to figure by the time you're, in your mid-30s, you're definitely at risk.
It's caught up with you. And luckily, the kids that are growing up now, a lot of the parents are really hypersensitive to making sure they get sunscreen. I know I am. My poor kid, she can't walk out the door. I'm chasing after her, and I covered that kid in sunscreen every day, but she's very fair.
Right.
And I just don't want her exposed to that. And it worries me when I see a new freckle.
Exactly.
And things like that are kind of scary. Luckily, skin cancer has never been found in my family. Is that hereditary?
I've had it several times, and I've had a melanoma. So it can be. That's one of the questions we always ask in the workup about family history and eye family history and systemic family history, to see if there are things like that, for which we would then really be looking and have them come back for further evaluations. It can be hereditary, but it doesn't have to be. I think Melissa made a great point about the cumulative effect of exposure, and then you did too, in terms of 4 to 5 extreme sunburns
over your lifetime.
Setting yourself up for that. Skin cancer, I've had numerous times because I've been outside. I'm fair. I think also what would be interesting to folks to know is that the lighter the color of your eyes, the more susceptible the back of your eyes are to damage from ultraviolet light. So, yes, there's a lot of people that don't know they have it.
They probably don't even realize that they could.
There's lots of different types: squamous cell, basal cell, melanoma. Melanoma obviously being the most deadly. But I've had all three.
Oh, my goodness.
And the worst was the melanoma, which appeared as a tiny, tiny freckle. And I did happen to go to a skin doctor, and they said, tell me that wasn't there before, and it was so small. I thought, well, I don't know.
See?
And they biopsied it, and they said it was positive. So
I'm telling you, you don't mess around with it.
Exactly.
And if you have children, now is the time to start slathering the sunscreen on them, making sure they have the appropriate kind of sunglasses, because this is where you're responsible for them. They don't know that they need sunscreen, and I know they hate putting it on. I do. Like I said, I've got a little girl. She has light blue eyes, and now I'm thinking I have never made her wear sunglasses a day in her life, and that's on me. So I'm going to definitely go and get her a good pair of sunglasses.
But one thing I think we've really learned, and I have too because of my history, is that zinc dioxide and titanium dioxide is extremely important, where most people pick up, I guess I shouldn't use any brand names, but most people
they
that
know,
pick up that
yes.
says 30 proof or 50 proof or 90 proof or whatever, and we think, it's PABA and that's I'm doing great by my kid. I've got that on there. But unless the back says zinc, that zinc is included in that, it's still allowing a lot of ultraviolet light over. And that's why I say keep applying.
There are two different kinds of there's chemical sunscreen, and then I think zinc is the natural one. Right. And what the chemical one does is just reflects the sun. It doesn't really protect you at all, whereas the zinc actually protects you. And so it's nice if you can find one that has both. Right. But the zinc is the much more important ingredient when you're looking for a sunscreen. And I know you won't brand drop, but I will, because we've recently done this topic on our morning show. A lot of the big brands that you think, because I know the name Coppertone or because I know the name Banana Boat, I know that that's going to be a safe sunscreen. Just because you see that brand and you know that brand does not mean that that's a safe sunscreen. Exactly. And you can actually Google the safest sunscreens and you'll find nice lists that not only tell you which ones are good, but where to get them and why they're important, why they're better. And so, sorry, I didn't mean to get up on a soapbox.
I'm impressed, Mandy.
Well, we just did this topic a couple of weeks ago, so it was like, ooh, I know about this. Exactly. Let me jump up and down, because I don't know very much about eye care other than I do know it's important that you go every year. I know a lot of people don't think about it, but it is very important that you go at least once a year, and if you have hypertension or diabetes, you need to go more than that. And if you go and you see the eyewear gallery, one of the doctors there will help you figure out what your particular situation is. So we've covered all of that and why it's important to get an eye exam every year. You do see children?
We do, as young as age 2.
See me doing personal things again during the show. That's the way it works. Again, this is Dr. Warren Johnson and Melissa Moore. They're with the Eyewear Gallery, and they're at Poplar and Perkins. What's a phone number someone could call and reach you if they have questions or want to make an appointment?
Okay, 901-763-2020.
And do you have a website?